A lot of people want to know what's the best graft option for an ACL reconstruction. And the truth is there's no perfect ACL graft option because it depends on your activity level, your age, and your future goals. So based on what you want to do, there are different options. The first thing you have to decide is, do you want to use autograft, your own tissue from a place in your body, or allograft, someone else's tissue who's passed away, a donor tissue. Autograft will weaken the area that we take it from, while allograft will not weaken a part of your body, and that's the major benefit of using an allograft. Now there are three major autograft options. The first is patellar tendon autograft, and that's what we use in the majority of our high-end athletes who are playing high-level sports. Patellar tendon autograft, because it has bone on both sides, and we take it from the middle third of your patellar tendon, which is right below your kneecap and attaches to your shin bone, the bone on both sides allows it to incorporate faster and more reliable than just a soft tissue graft that doesn't have bone on both sides. That's the major plus for a patellar tendon autograft. But the major downside is that it weakens your quad muscle and also can cause anterior knee pain, pain in front of the knee from where we take the graft, or kneeling pain because the incision is right over your shin bone. Quadriceps autograft can be a great option because you don't have to worry about the anterior knee pain since the incision is taken above the kneecap. We can also take bone from the top of the kneecap, so it can have bone on one side, but it'll also weaken your quad muscle, similar to the patellar tendon autograft. The biggest benefit is that we're using your own tissue and you don't get any pain in the front of your knee or when kneeling like you do with patellar tendon autograft. Now, hamstring autograft is another good autograft option, but it has slightly higher failure rates in some studies. The reason hamstring autograft might not be as good as patellar tendon or quad tendon is because it's an all soft tissue graft which can loosen over time, and additionally it's taken from your hamstring muscle, which is the secondary stabilizer of the ACL. People who have weak hamstrings oftentimes have higher risks of ACL tears, so we wouldn't want to weaken that area further because that could increase their risk. With hamstring autograft, however, you don't get any of that anterior or kneeling pain that you get with the patellar tendon autograft, and overall, it's a good option for recreational athletes. And as I mentioned before, the best thing about allografts using donor tissue is that you don't weaken any part of your body. Now, the main difference between autograft and allograft is that autografts have been shown to have higher success rates in higher level athletes that are younger, such as people younger than 25 who are playing college and high school or professional sports. Now, over 40, however, autografts and allografts have similar clinical results. They have similar rates of success. So it means that if you're over 40 or you have lower levels of activity, you can use somebody else's tissue and have just as good of a result without weakening your own body.